Acute stress disorder. According to the DSM-5, acute stress disorder is when a person has had exposure to an actual or threatened death, serious injury, or sexual violation in one or more of the following ways: directly experiencing the traumatic event, with acute stress disorder. According to DSM-5, acute stress disorder is when a person has had exposure to actual or threatened death, serious injury, or sexual violation in one or more of the following ways: directly experiencing the traumatic event, witnessing the event in person as it occurred to others, and learning the event occurred to a close family member or close friend. There are suggestions that acute stress disorder is a precursor for post-traumatic stress disorder. Symptoms. There are some factors that elevate the risk of developing acute stress disorder or past psychiatric disorders, prior trauma, greater trauma severity, avoidant coping, high neuroticism, and being female. There are different ways to recognize acute stress disorder, which are the following: anxiety, numbness, avoidance, depression, and agitation. There are some situations to where an individual will lose touch with reality and start to have abnormal thoughts going through their head. Treatment options. Treatment 1. Psychopharmacological treatment, selective serotonin reuptake inhibitors, antidepressants, tricyclic antidepressants, benzodiazepine, monoamine oxide inhibitors. Treatment 2 is psychotherapeutic interventions, an early supportive intervention, psychoeducation, and case management appear to be helpful in acutely traumatized individuals because these approaches promote engagement in ongoing care and may facilitate entry into evidence-based psychotherapeutic and psychopharmacological treatments. Treatment 3, psychoeducational. Educational materials often focus on the following situations: expected psychological and emotional response to traumatic events, strategies for decreasing secondary or continuous exposure to the traumatic event, stress reduction techniques such as breathing exercises and physical exercises, the importance of remaining mentally active, the need to concentrate one's self-care task in the aftermath of trauma, and recommendations for early referral if symptoms persist. The prevalence rates for acute stress disorder: 8 to 20% involved with traumatic events, 8% developed among injured children, victims of violent crimes is 19%, and 18% are children and adolescents involved in assault or motor vehicle accidents. According to the National Center for Post-Traumatic Stress Disorder, states the following about prevalence rates: 13 to 21% are following motor vehicle accidents, and 14% after brain injury, 24% following assault, and 59% following rape. I hope that this gives you more of an insight into acute stress disorder. Have a nice day.